Going now, and competitive trends in the healthcare industry will come to light this morning. The Competition Commission is at this hour releasing its findings following a probe into the state of competition in the healthcare industry. Now from Sandton, our economics reporter Liabo joins me now live. Liabo, thank you very much indeed for your time. Just give us a bit of background firstly. Why did the Competition Commission embark on such an investigation?
Good morning, Blaine. Well, this health inquiry comes on the back of a lot of complaints, particularly with the pricing structures within the private sector, the healthcare private sector. What this inquiry looks at, it looks at the role of doctors and specialists, the role of technology, and how pricing systems are measured. You remember that the role of the Competition Commission is to it's to measure competitiveness within sectors. So what they're trying to look at is whether you as a consumer or as a user of a medical aid scheme, you are getting the best possible deal from medical aids, their pricing structures and the services, and whether all their pricing that they have is actually justified. You know that medical aids, particularly the private medical system, is extremely expensive in South Africa. So they want to see what informs that pricing. I have asked Mr. Clint Oleman, who is the inquiry director, to join me this morning so that he can explain a little bit better about what went into this inquiry, how they conducted the methodology, and what we're expecting to find. Mr. Clint, thank you very much for your time.
Good morning.
First of all, this inquiry is quite late in terms of releasing its finding and recommendations. We were expecting this by the end of last year. What has been the delay? And on top of that, what are you looking at into this inquiry? I did mention just a little bit to our viewers about what you're looking at, but you can tell us a little bit deeper into what you're looking at.
Yeah, sure. Thank you. Nice to talk to you this morning. Yeah, I mean, it's a big day for the inquiry. We're releasing our provisional findings and recommendations report today. It's the culmination of 4 years of hard work by the panel and technical team. We did want to publish at the end of 2017, you're quite correct. One of the major delays that we had was we had a lot of stakeholders that still wanted to interrogate our methodologies. In the private healthcare sector, there is an issue with data and information. The inquiry spent a lot of time collecting data and information throughout the duration of the process. And we have now probably one of the largest databases ever collected on the private healthcare sector in South Africa. So a lot of our analysis is based on the data that we've collected from stakeholders across the entire private healthcare sector. We've collected data from over 165 stakeholders. We've analyzed that data. We've looked at various methodologies. We've looked at what stakeholders had to say, and we've also taken on board what the general public have to say and where their issues and concerns are. Today is the culmination of that. As I said, we're going to be releasing the report. Essentially, the inquiry was started to look at what are the cost drivers and main reasons for high expenditure in the private healthcare sector. And obviously the panel was appointed to look at where there are competition concerns, how the market is structured, how the players in the market interact with each other, are there deficiencies from a competition law perspective and things like that.
We have reason to believe that we pay exorbitant prices. During your public hearings, what were the biggest concerns that came out from the consumers or the public at large?
So during the public hearings, there were a lot of issues raised by consumers on particularly around costs. They don't always understand the costs that they pay. To them it seems high, and they don't always understand what they're paying for. If they have a medical aid, they don't necessarily see their bill, so they're not always sure what they're paying, and they make contributions on a monthly basis to medical schemes, to premiums. And as I said, one of the biggest issues that they found is a lack of information sharing with them and the medical schemes. Also, out-of-pocket expenses when they go to hospital. They raised issues around the bills that they receive. They have medical aid, but there's also an additional co-payment which they have to pay. And those are the types of issues which the consumers raised during the course of the public hearings.
When you compare us with perhaps the rest of Africa or maybe the rest of the world, are we necessarily one of the most expensive private health care, or is our private health care probably the most expensive that there is?
Look, I don't want to go into too much of that detail now. I think that's what the panel chair, retired Justice, Chief Justice Sandile Liabo, is going to be highlighting during the course of his presentation. So I think for purposes of today, we want everyone who has an interest in the private healthcare sector, and that's most of South Africa, to digest the report once it's released and give us feedback. We're going to give a comment period, which the judge will announce as well, for people to respond to the report and interact with us and give us feedback and make submissions on the recommendations that we're making and some of the findings that we're making.
Just so that we're clear, this has to do with private healthcare and not public.
That is correct, yes.
And let's talk about cooperation. Did you receive enough cooperation, perhaps from the stakeholders or everyone that you needed information from?
Yes, look, I mean, it's a very big sector. So we spent a lot of time engaging with stakeholders throughout the process, right up until the end, up until we are here today. There's been a lot of stakeholder engagement. It's been good. There have been areas where it could have been better, but we've taken a lot of time and effort to make sure that we've been as open and as transparent as we can be in terms of this process.
So if my viewers want to participate in the comment giving after the report has been released a little bit later, how can they go about that? Who do they contact and where do they go?
Yep. The report will be published on the website later today, so it will be available for everyone to access on the website. And everybody has an opportunity to read the report, digest the report, and make submissions. In the report and on the website there will be details on how submissions can be made. They can be made mostly in the form of written submissions. The panel will still consider whether they're going to have further engagements after the provisional report is published. Depending on the responses that they receive, there may be a need for additional areas where we want to go and engage with public or other stakeholders. But that's a decision that will be taken post-publication of the report.
Mr. Ullman, I know that you have to get going. Thank you very much for making time to speak to us.
Great.
I do appreciate it.
Thank you very much for your time.
All right. Blaine, well, let me just give you a little bit of a glimpse of who we are expecting to be heading this recommendations and this briefing. Behind me, I see that Professor Sharon Fawn, she is going to be here, and also the Minister of Health, Dr. Aaron Muzwaledi, is going to be here as well. We will have Justice Sandile Ngobo, who was the chairperson of the inquiry. He is going to be here as well. We're going to have Dr. Lungisa Ngongi, who also was part of the health inquiry, and also we will have Dr. Ntutugo Pengu. These are all the people that were instrumental in putting together the reports and the findings and the recommendations that we are going to be receiving in just under 30 minutes. That's when the press briefing will be starting, and we will find out indeed if we are paying too much when we go to private healthcare facilities, or if we are not, if it's fair, if the pricing is justified. And of course, like Mr. Ollerman said, that you will have a chance to look at their website and make your views as a viewer at home and make your recommendations and what you think could have been done better, should have been done better. But trust the SABC News channel to bring you this briefing live as it happens here in Sandton in Johannesburg.
Indeed. Liabo, thank you very much indeed for your time.